Welcome to Beyond the Shot, an enlightening podcast series brought to you by a trusted healthcare and evidence based companion, Stepcare. Coming to you from the bustling city of Bangalore, I'm Dr. Suneet, your friendly neighborhood physician. In this series, we will delve deep into the fascinating world of vaccination at all stages of life: childhood, adulthood, and the golden years. Vaccinations are marvels of the medical world, little vials of hope, and the frontline warriors in our ongoing battle against the myriad diseases. Today, we start a stimulating journey guided by insightful experiences from our two wonderful doctors, Dr. Debarati Das, a passionate pediatrician with a penchant for our little chip ones. Welcome, Dr. Debarati Das.
Thank you so much for your kind words.
Prepare to be amazed by tales of yesteryears, how our wonderful doctors and scientists, right from Edward Jenner, stumbled upon concoctions to find cures for smallpox, to the path-breaking and revolutionary mRNA technology pioneered by Dr. Calrock and Dr. Wiesmann, which in fact won the Nobel Prize for Medicine and Physiology in the year 2023. What better vaccine to start and set the ball rolling than the biggest adversary mankind has known until today, tuberculosis? And with this, we embark on our journey. So, to begin with, Dr. Debarati Das, I would like to know what is tuberculosis all about?
Well, tuberculosis is a disease. It is caused by a bacteria called Mycobacterium tuberculosis. So the germ basically gets transferred from an infected person to the other via droplet. So suppose an infected person in their lungs they are infected with, and they are coughing, sneezing, singing, even talking.
Okay.
So they spread the droplets in the room, and the droplet carry the bacteria for longer time than you think it can. So even in absence of the infected person in a room which is not well ventilated, so it can infect the other people who are coming to the room,
Okay.
right? So once it is inside your lungs, so it basically gives you the infection in the lungs. And depending on the immunity level you have, it either get contained in the lungs itself, or it can go and spread the other organs, which we call extrapulmonary tuberculosis. Now, among the pulmonary TB and extrapulmonary TB, so the TB of the brain, which is one of the deadliest in the tuberculosis infection, the most incidence affects the children below 5 years of age, and India accounts for the 26% of the total TB cases in the world, right? So early detection of the cases, prompt treatment, and vaccination is the key to manage this condition.
Okay, so we've had insights about what TB is. It's different kinds, mainly pulmonary and extrapulmonary. And Dr. Debrati has rightfully pointed out that brain TB or TB of the brain is one of the most deadly forms of TB that can affect or inflict any individual. And the way to combat it is personal hygiene, definitely, and aggressive treatment, which was preceded by early and fast detection. So, for this, we also have a champion in the form of a tiny vial that guards us and protects us right from the time we are born on the first day or the 0 day of life, BCG. So, what is this BCG vaccine all about, and what is its schedule in India?
Yes. So BCG vaccine, the whole form is called Bacillus calmette-guerin. This is the only vaccine we have for the time being for the public. So this is a live vaccine. Live vaccine means it's a TB germ, but it's a weakened TB germ, right? So it should be given to all newborns in our country, because our country is high prevalence and high incidence country, right? So the target is to give the vaccine before the discharge of the baby from the hospital, preferably within 2 weeks of life. In case the baby is missed vaccine within the 2 weeks of life, it can be given up to 5 years also. In that case, you don't have to do any MON2 test or any diagnostic test, ideally, as per IP recommendation, to get the catch up vaccination done.
Okay. So, Dr. Debarati has pointed out that TB is prevented, or you safeguard yourself from TB from Bacillus calmette and guerin. And a very interesting caveat of information regarding calmette and guerin is that they were in fact trying to find a cure for bovine tuberculosis when they actually were treating bile-stained potatoes, and they found that this particular medicine or this particular like vaccine could actually reduce the multiplication of this particular bacterium. And that is how they stumbled upon this discovery. And this was found to benefit so many people. In fact, more than one fourth of the entire TB burden is seen in India. So it is almost imperative that we are the forebearers and the frontrunners in any form of TB research, and that has been the case with our pioneering National Tuberculosis Institute in Chennai, which was formerly headed by Dr. Soumya Swaminathan, who then went on to be the chief scientist of the WHO during the most dangerous pandemic that any millennial has ever seen. So, as you mentioned about the BCG vaccination, which is given on day zero or the first day when the baby is born, what are the kinds of changes that you see in a baby once you administer this vaccine? Is there a particular site where it should be administered? And is there a particular reason why it's normally administered at that site?
Yes. So the vaccine is given, it's a universal site. So vaccine is given in the left upper arm. So unlike the other vaccines, which mostly we give in the muscle or sometimes in the fat layer, this is given intradermally within the layers of the skin. So after the vaccine, for first several days, typically you don't see much changes. Then over 2-3 weeks, there is a formation of papule, which is like a small elevated skin lesion, which increases in size over next few weeks to about 4 to 8 millimeter. It reaches by the time the baby is 5 to 6 weeks of age. And for some babies, it recovers and forms a scar at that point of time. And sometimes it may rupture and ulcerate, and that also heals over time. So it any time between 6 weeks to 3 months it can take, and certain babies I have seen it may take up to 5 months to form the final scar. So this is not abnormal; it's absolutely normal. Many parents are very apprehensive about the scar because it looks really scary, but it is absolutely normal. And 10% of the population, they don't develop any scar, but that doesn't mean the immunity has not been received.
I'm sure this vision and this thoughts of Dr. Debrati are really insightful for all the young new parents out there, because definitely seeing something almost like an ISO on your baby, on your little one's arm can really drive you crazy, wondering if this is normal. And I'm sure this has been really reassuring to know that this is a very normal process. And even if you don't see a scar, the vaccine that was given is definitely effective. So it is in fact a very safe vaccine, right? But are there instances where this can become unsafe, or are there any cohorts of children who shouldn't be receiving this vaccine, Dr. Debrati?
Yes. So BCG vaccine is safe. Like any other vaccine, it comes with certain side effects, which the most commonly seen side effects are, as I told you, the scar. Sometimes, the papule which is formed, it can develop a pus and it can drain. Sometimes there will be a formation of a lump just under the armpit, left armpit. That also resolves on its own. And that too, these side effects happen to a very small cohort of children who receive the vaccine. Now, coming to the question, who should not receive it? So, there are conditions where we defer giving this vaccination. All right. So, as I mentioned earlier, this is a live vaccine. So, for a live vaccine to work, you need to have a normally functioning immunity. So, anywhere for a baby, if we have the question, if the immunity is not properly developed, there are certain conditions like if a baby is born to an HIV mother and the baby is unstable at birth, we don't give the vaccine immediately unless we see how the baby is doing. Next thing, if the mother has been treated with certain drugs which would have given some trouble to the immune system development, in that case also we wait. And if there is any history of any family history of early infant death within the first 1 year of life, then we actually inquire and see if there is any genetic or hereditary immune system related any problem for the baby before giving the vaccine. So these are the candidates uh, in which case we actually defer giving the vaccine and we properly evaluate before giving the vaccine.
Thank you so much. So, Dr. Debarati is very well mentioned about these vignettes of information that I feel should be etched in indelible ink so that you know for sure who is to receive the vaccine, who is not to receive the vaccine, and what are the kind of contraindications to receiving the vaccine. So, a very robust immunity of the child is almost mandatory to be receiving the vaccine. So we've already understood about how safe this vaccine is and who shouldn't be receiving it. But I've often heard and we often know there are a lot of advanced and developed countries where the incidence of tuberculosis is not so high. They don't receive the vaccine at all. So can you shed some light upon this?
Yes. So, according to WHO, the vaccine should be given in countries with high prevalence rate of TB. India comes under the high prevalence rate. All right. So, we should be giving the vaccine to our children. Now, in certain countries where the prevalence rate is not so high, but the children have the high risk of getting the infection, in that case, also it is given. For an example, if a child is traveling to and fro from a country, high endemic country, or in an area, the child is coming from an area with a high risk of developing the disease, in that case, the vaccine is given. And I see many cases where children are born abroad, but they have shifted India, and they have the question of, I mean, they want the BCG. I mean, they should be getting the BCG vaccine or not. So below 5 years of age, again, as I mentioned earlier, you can get the vaccination
Yes.
done without actually, I mean, going through the Montu test as per Indian Academy of Pediatrics.
So this is very, in fact, very, very useful what Dr. Debarati has just told us, that even children who are born in well-developed countries, while they travel or come to India, which is known for its tuberculosis burden, should in fact be vaccinated before the age of 5 years, as recommended by IAP or the Indian Academy of Pediatrics. So there was a very interesting survey that came across in 2019 by the National Prevalence of Statistics that in fact mentioned that more than 31% of adults aged 15 years or above have been exposed and infected to tuberculosis. That is a whopping one third of a population of almost 140 odd crore people. And if you look at the adults, we fall the bulk of the society. And in a society that is afflicted by such a monstrous disease, I'm sure there must be so many myths out there that we want some busting to be done at this podcast. And I think there's no better person out here to be doing this myth busting. So, what are the kind of myths that you come across? Because although it's a pediatric vaccine, we see cases of tuberculosis mostly in adult life. So, you as a pediatrician can definitely give your insights into what other kinds of myths that is so prevalent in a society like India, which is so replete with tuberculosis.
Yes. So, first myth is BCG vaccine prevents you from catching TB. So, this you have to understand. So, BCG vaccine is not going to prevent you from catching TB. It basically prevents and controls the severe form of TB, which is, as I told you earlier, the miliary TB, extrapulmonary TB, TB meningitis, which is the deadly, a little more serious form of TB. BCG vaccine prevents that from happening, but it doesn't stop you from getting the infection.
So, ma'am, there's a big myth that's going around that BCG vaccine, is it the only solution or the panacea to stopping the global epidemic of tuberculosis? Or do we have within our arsenal of medicines anti-tubercular drugs more equipped or more effective in combating this menace?
So, as you mentioned, yes, so vaccination is not the only way. So, we have to detect the cases, active cases early, and treat them promptly to prevent the spread of the infection. So, that's
Thank
it.
you, ma'am. So, definitely active detection and aggressive management for an intensive period. And to disseminate this kind of information to a population like India, we had one of the biggest global superstars from our country, Mr. Amitabh Bachchan, to spearhead the TB campaign. And the slogan read, TB हारेगा tab देश जीतेगा. And you just mentioned that active detection is one of the most vital aspects. So, how do I, as a person, know that I am infected with tuberculosis? Am I always going to be symptomatic or is it going to be asymptomatic? So, what are the cues that a common man should look out for to know if he's infected with tuberculosis?
Yes. So, infection with TB doesn't necessarily mean that you are actively having the disease. So, you could be infected, and for many years, you might not have any symptoms at all. So, it's very difficult to understand if a person is infected or not. But there are certain symptoms which might prompt towards the disease. If you're having, fever for 2 or more weeks, or without fever also, if you're having chills, night sweats, unexplained loss of weight, loss of appetite, and if you have any symptoms regarding your lungs, prolonged productive cough, breathlessness, then you should visit your physician, and further investigations will take place to actually detect the TB. It's not so straightforward when it comes to TB diagnosis, but as the most common symptoms noted, I mentioned, if you see that you have such symptoms, you have to go to a general physician.
So, TB, in fact, is the most common masquerader that we have in the Indian healthcare system. So, any diagnosis before we rule out anything else, the first thing we rule out in India is definitely tuberculosis. And certain things we definitely have to look out for, as Dr. Debarati rightly mentioned, night sweats, chills, evening rise of temperature, and chronic cough, be it productive or not, for over 2 weeks. And we have beautiful tests in the market to actually diagnose this. So, ma'am, it's kind of common grapevine that TB is normally seen in the lowest social strata. Is it in fact true that only people of the lowest socioeconomic strata are affected with TB, or is it just another myth that we are just grappling with?
So yes, people with lower socioeconomic strata, they get the infection, but that doesn't mean that they are the only people, right? So it all depends on the environment you stay. If you are staying in an urban area, very crowded place with ill ventilated room, or your place is ill ventilated, you will, irrespective of your socioeconomic status, you can get infected. So this is another myth.
Okay. Thank you for that myth busting session. I'm sure that all these myth busting has helped us empower ourselves to know what is it that is true about TB and what is it that is just propaganda. So, as an individual, what can I do for myself and my family to kind of safeguard myself against tuberculosis or prevent the incidence of tuberculosis other than just getting my mandatory vaccine at birth?
Yes. So, few things you have to be aware of. In case if you know a person in your family, a friend, or in your surrounding who is suffering from active TB, please get the person, I mean, encourage the person to get treated. Because as long as the active TB case is there in your surrounding, the person will still keep on spreading the bacteria via droplets in and around. Next thing is, of course, I mean, for your safety and other safety, whenever you're coughing, sneezing, you always use your hands or tissue paper to cover your mouth, or use your elbow, and afterwards throw the tissue paper. Maintain hygiene, clean your hands. Next thing is, um, wherever you stay, your workplace, your home, try to keep the room well ventilated. Proper cross ventilation should be there, and just try to see if direct sunlight is coming to the room or not. And infection, regarding the infection, as I told you, you can get infected, but that doesn't mean that the disease is there. So you might be infected for many years, and just the bacteria will sit in your body waiting for the right moment to uh, come out in glory. The moment your immune system gives away, and that could be due to poor diet, poor lifestyle, lack of exercise, lack of good sleep, that can actually weaken your immune system, and the infection at any point of time can bring out the disease. So, of course, you have to maintain a good lifestyle with regular exercises and good sleep.
So, thank you for all these wonderful tips of how we can conquer or evade this sneaky predator, as Dr. Debarati rightfully mentioned. It just waits to pounce on its prey like the most fierce animal out there in the animal kingdom. So, we had a wonderful discussion, Dr. Debarati Das. Thank you for your wonderful insights. And I'm sure all of our listeners here have thoroughly enjoyed this experience. Thank you for your wonderful time. And until next time, we meet you with another exciting and exhilarating series of Beyond the Shot. It's goodbye from me, Dr. Suneet, your friendly neighborhood physician from Stepcare. Thank you.
Thank you.